Hi. Often I have clients who come to me with the understanding that they are stuck in an anterior pelvic tilt. So perhaps they've consulted a personal trainer or a massage therapist or a chiropractor or maybe even a doctor. And usually they go to see somebody and they seek that advice because they have lower back pain, chronic lower back pain. So those people will often present like this. So obviously, if you look at my lower back, it does look too lordotic. And it might feel compressed or tight. Sometimes people that have this are compelled to stretch it sometimes for relief. And if you look at the front of the body, the abdominal wall is lengthened, distended, and will often test weak. So the advice these people are usually given is to engage the abdominal wall, draw it in towards the spine, or maybe pull the pubic bone up using the abdominal wall, and to use the glutes to tuck the tailbone under. So it seems like logical advice at first because it does give you that immediate relief. It lengthens the lumbar spine, it stretches those tight muscles, and it certainly makes you look better. If your posture is usually here, then most people are going to be happier if they look like this, right? That kind of looks better than that. The problem is that a chronic contraction of the abdominal wall is very hard to maintain. And of course, the minute you let it go, you're back in the original position. So it's not a great long-term solution. And in fact, a chronic contraction of the abdominal wall not only is difficult to maintain, but it can interfere with your digestive processes, your elimination processes, and that chronic tail tucking and engagement of the glutes can affect your hips, knees, and even your pelvic floor. So what is the solution then? What is the long-term solution? So let's look at what an anterior pelvic tilt actually is. If you think about the bones of the pelvis from the front, we've got the ASIS bones at the top here that stick out, the anterior superior iliac spine. And in a neutral pelvis, the anterior superior iliac spine, ASIS bones, are stacked vertically or plumb over the pubic bone, or the joint known as the pubic symphysis. In an anterior pelvic tilt, it's a rotation. So if you think of a bicycle wheel as you're going forward, the wheel rotates forward at the top and backwards at the bottom. So an anterior pelvic tilt is where the pelvis rotates forward at the top, backwards at the bottom, and the ASIS bones end up out in front of the pubic symphysis. A posterior pelvic tilt is the opposite. It's going backwards. All right, the wheel is rotating backwards, so the top of the pelvis rotates back at the top, and the pubic bone ends out in front of the ASIS bones. So when you're standing in this position, if you go by the curvature of the belly and the quadriceps and the glutes, it certainly does look like my pelvis is tilted forward and the ASIS bones would be out in front. So it does seem logical that the solution would be to post-tilt the pelvis to neutral. But in fact, if I put one finger or my thumb here on the ASIS bones and my middle finger on the pubic bone, they're actually stacked vertically. They're plumb. So this is a neutral pelvis. How can I have a neutral pelvis and still exhibit a shortened lumbar spine and a lengthened abdominal wall? Well, there's something else going on here. This something is called an anterior pelvic shift. Now, a shift differs from a tilt because a tilt is a rotation, but a shift is simply a translation. So it's a little bit like pushing a chair across the floor. The pelvis is staying upright, it's just moving forward in space. So here's one way that you can assess whether you have an anterior pelvic shift. Take your habitual or normal stance, and if you're in the habit of engaging your abdominals and trying to correct your posture, just let that go for a minute. Let your belly drop forward and down. Let your tailbone float up and back and your glutes soften. And you're just going to take a moment to notice where the weight is in your feet. So right now I can tell the weight is in the front of my feet. You might even feel some pressure of your toes on the floor. They might be gripping or clawing because essentially you're falling forward here and you're resting on the tissues that run across the front of your hip. You can probably lift and lower your heels and bounce on your heels without moving your trunk forward or back in space. So if that's the case, you have an anterior pelvic shift. And the solution to that is not to draw the abs in and tuck the pelvis, because I'm still on my forefoot. All right, so relax the belly. What we're going to do is take the pelvis and shift it backwards in space until you feel the weight come off the forefoot and land in the back third of the foot, the heel and the ankle. So now I can lift my toes and even the forefoot a little bit, but I couldn't lift my heel without shifting my pelvis forward. Okay, so the heel, the leg is vertical, and the weight of the pelvis and the rest of the body is traveling through that vertical leg into the back of the foot. Now, as you'll notice, the lower back, as I shift my pelvis back, my lower back lengthens and my abdominal wall shortens. So it goes back to its normal resting length as the bones that the abdominal wall attaches to get closer together, which means the abdominal wall tone is appropriate for its resting length. So you don't have to overwork and chronically engage all the time. So there's your long-term solution. Although it seems simple, and it is simple, it may not be easy at first, because if you're in the habit of leaning on these tissues, shifting your weight back is going to be interpreted by your nervous system as falling backwards. So until the muscles and the back of the hip, the glutes and the hamstrings are strong enough to support you, you might feel like this might be a process that you have to practice over time. So make sure you're doing this barefoot or in socks, because you can't do it wearing heels. And just shift your pelvis back anytime you find yourself standing until you have a vertical leg. The pelvis is still neutral. My lower back is in its normal lumbar curve, and the abdominal wall is now relaxed, but still toned. So I hope you found that interesting. Please like this video, share it with your friends, and subscribe for more informative videos like this one. I'll talk to you soon.